Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is seeing a patient who has been struggling with a collection of anxiety and depressive symptoms. She is resistant to pharmacotherapy and prefers to begin with a psychotherapy approach. As it turns out, the primary source of her symptoms is that she is married to a spouse in the military and has had to move thousands of miles from home, friends, and family. An attempt to implement solution-focused therapy would include which of the following techniques? A, motivational interviewing, B, cognitive restructuring, C, social skills training, or D, the miracle question. Again, you're not necessarily expected to be a therapist or skilled in implementing therapy, but as a psychiatric mental health nurse practitioner, you are expected to understand the various types of therapeutic modalities, know what they are, what they're best used for, and refer your patients appropriately. So you do want to know the main features or the main aspects of these different therapeutic modalities. In this circumstance, solution-focused therapy is described for you in the question. That's what we're talking about here. So the question is really very simple. Solution-focused therapy, which is a defined therapeutic modality, would include which of the following techniques? A, motivational interviewing, B, cognitive restructuring, C, social skills training, or D, the miracle question. And so this really is an intervention question. You're expected to be conversant in these various interventions. The answer is D, the miracle question. The miracle question directs the patient to finding a solution. That's why we're talking about solution-focused therapy here. Motivational interviewing is really about the client exploring his or her own needs and resources. Motivational interviewing is really more of a humanistic approach to therapy. It's not like the therapist really guides the patient toward a solution or suggests a solution or works with the patient to modify thoughts or behaviors to achieve a solution. Motivational interviewing really is about the patient doing the work, the patient doing the exploration. Cognitive restructuring is also different. Cognitive restructuring is really about realigning negative thought processes. The person who is like, I can't do anything right, one thing goes wrong in their day and the whole day is a catastrophe, how they restructure that. Social skills training is really very specific. I mean, the name tells you it is a training to learn or master a specific skill, and in this case, social interaction. That doesn't appear to be any of the problem here. I mean, the issue is that the patient had to move and she's having some depressive symptoms, and she knows why, because she had to move thousands of miles away from friends and family, etc. So solution-focused therapy is certainly a very appropriate approach. And as a side note, solution-focused therapy, remember, is designed to be a time-limited therapeutic modality. Many forms of therapy take months and months and months and even years for the patient to achieve a result. And a lot of people just don't have the time or the money, the insurance, the resources, whatever. Solution-focused therapy was intended to be the short term. So it's not about exploring your childhood or restructuring your whole approach to the world. It's about finding a solution to the thing that is the big problem right now. And in this case, it is the fact that she had to move. So in solution-focused therapy, there are a number of techniques, but it's really about trying to figure out what the patient wants and then facilitate them in identifying a way to get it. And that doesn't always mean that they get exactly what they want, but it may be about helping them find a compromise or something that they can live with. And so some of the techniques are things like the miracle question. You say to the patient, all right, you're unhappy, you're depressed, you have anxiety for this reason. So, okay, if you woke up in the morning and the problem was solved, how would you know it had been solved? Like, how would your life be different if it had been solved? and then you enjoin the patient in trying to visualize how to get there. Now, in this case, the patient might say, well, if my problem was solved, I would be home. I would be back home with my friends and family. Well, okay, if that's what it takes to relieve your symptoms, can you go home? How about you live separately from your husband or your wife? There I go with my implicit biases. How about you live separately from your spouse until your spouse is no longer stationed far away from home? That's one option, and then you can help the patient to explore the pros and cons and the feasibility of that. If that's not feasible, or if that's not what they really want, maybe it's not really that they want to be home with family and friends, but they're missing some of the qualities of life or aspects of life that they had with those family and friends. So maybe a big part of life with family and friends was, I don't know, bowling on a league a couple times a week, or, going to wine and paint, or something. Perhaps the solution lies in integrating into the local community to get that. So now listen, I'm no therapist, so I don't presume to have all the answers here. But the concept is, with solution-focused therapy, all right, the miracle. If you woke up tomorrow morning and your problem was solved, what would life look like for you? That's just one technique. There's other techniques in solution-focused therapy, but the idea is that it's really about identifying the problem and then helping the patient identify and work toward a solution. It's a very specific, focused approach to the world, and that's why it's called solution-focused.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.